Hi guys, welcome to the Revive Stronger podcast. I'm your host as always, Steve Hall, and today I am joined by Dr. Jacob H. Templar. So some of you may know Jacob. He is part of the Strength Guys, who are kind of a big prolific online coaching company within our sort of little niche. So he's working with them, and he is also a doctor of physical therapy and has been putting out some really, really cool stuff over on his Instagram, which is the Strength in Evidence Physio. And I think it's, for me, was quite refreshing to see some of the content that Jacob was putting out. So I wanted to drag him on the show and dig into his brain. But Jacob, before I continue, I know you're a father. Is there anything else you want the listeners to know about you?
Yeah, I'm a dad. I am awake early. Hopefully my daughter sleeps through this. She normally does. Obviously, I'm married. My wife's a registered nurse. I work in Rochester, New York. I'm a physical therapist at a small practice called Physical Therapy Service of Rochester. So I not only get to work with strength athletes, but I work with the general population anyways, like average, what most physios would see anyways.
And in terms of your own background, what kind of got you into physio, and what's your sporting background? I assume you train in things. What are your kind of goals as well? I always find that interesting.
Yeah, so I started in American football playing. I was an offensive lineman. I was fairly like overweight and stuff in high school. So I played offensive line, defensive line. I started with that, got into gym training because that's kind of what led me into being like a good player for my high school. So I was like started when I was like 14 or 15, something like that. Just doing whatever the coaches were going to have us do in the gym, and then like what the older players did. And then from there, I went to college, played for a year at Division III, just kind of like, practice more than anything. And after that, played rugby for a little bit, and then got more into the gym from there, going through school and then figuring out stuff, learning from like online, going on bodybuilding.com, finding people like 3DMJ and Lane Norton and different people like that, and actually learning more about that. And now I'm actually two of our coaches I work with, Kedrick and Alfred. For a little while, we were recovering from me dieting down from, I was like 230 pounds to like 200. And now we're starting to build up my lifts again. So we're starting to get back up there with my squat and deadlift and everything.
Awesome. Yeah. Well, 30 pounds is no joke. So that's a hefty loss. So good job. I think it's always helpful, especially for physios. I find sometimes they're not as specific for like physique sports, and people listening to this, there's a lot of people who they see a physio and maybe they are just focused on like gem pop and they don't really train themselves. And so it can be really difficult to get the kind of really specific help that they need. Whereas you obviously train, so you get it and you kind of understand the injuries that maybe a trainee would pick up.
Yeah. And that's actually like a frustrating part of the profession, is that like so many people actually like underload patients, even like the general population.
In terms of underload, is that kind of like they don't appreciate how much they know about their individual situation, or?
Just in general, like there's this habitual, like not like just giving people enough weight to actually do what they need, like acquire the adaptation we're seeking. Because there's always this perception that people are, not that they're more, it's kind of like they're more frail, and in general, like physios are afraid to be a little bit more aggressive and like, oh, I'm going to actually have you do something that's going to actually develop a strength adaptation versus I think Adam Meekins, he's a physio in the UK, did a post on this. Is like, are you just having people do like general exercise, or are you actually having them do a strengthening exercise?
Yeah, I understand that. It's like doing yoga and Pilates and not really going probably past that. Whereas if we need, like you said, that adaptation, we've got to cause a stress to improve things. And kind of that's the beauty of resistance training, where it kind of improves like the strength of our bones and everything. So later in life, we're not going to be as fragile. Whereas, yeah, from the sounds of things, it sounds like a lot of physios potentially make people purposefully fragile later down the line, or that ends up being the case.
Yeah.
So,
Yeah, they either do it from not thinking about it, or things they say, or things like that.
yeah, kind of the scaremongering, maybe unnecessarily, or not even realizing that's what they've kind of ended up doing.
Yeah.
Something I wanted to touch on was actually a couple of your latest posts, because they're very relevant. Obviously, Instagram is generally relevant to the like here and now, and there's a lot of, and as we get deeper into like our understanding of things, and as technology improves, we're seeing kind of different techniques come out, and as ever, humans want a quick fix. Like we want it to be like shredded yesterday. We also want to be recovered yesterday. So you kind of did a really interesting post and how a lot of these techniques end up becoming band-aids, and physios maybe unnecessarily rely on them, and also trainees maybe get bought into them and they're not necessarily doing as much as we hope. So I don't know if you would like to maybe give some examples of those, what maybe when you would use them, when you wouldn't use them, and what maybe is actually the solution rather than kind of, using a band-aid, like whatever tools you're maybe going to mention.
Yeah, I think the biggest ones that I posted about, let me double check. I think it was like dry needling, which could also be considered like acupuncture, KT tape, which is like the colorful tape we see on like a lot of Olympic athletes now, theraguns, hot packs, even like foam rolling to a degree. There's a couple things that you'll only see in like a physio clinic. So like an ultrasound or like a low level laser. The ultrasound that we use is different from like the ones that you think of when like you're going to go get like a look at a baby or things like that, because they don't generate a picture. It generates heat.
Okay.
And then like cupping. So some of these things, it's not like there are times and places where you could potentially use them. It's just that they're way over utilized.
Okay.
It's different. Like some people argue about like creating an alliance with a patient or somebody that's in your clinic. But the problem is that a lot of people use it as like a catch-all. Like they treat everybody with this. It's not like they selectively use it and like select appropriately, maybe based on some of the studies that you look at. Like, you know, like we talk about evidence-based fitness. I know is a big, like people talk about it being a buzz term, but same with medicine. It's like people argue about like, well, you can't measure everything with science, but the problem is like if you also don't use objective science, that's where we get to where we are with like some surgeries, like where that surgery is no better than a placebo, and people are being convinced to continue to have this intervention that's kind of wasting their time and their money, for the sake of saying, well, I gotta get them to buy in. Well, did you need to get the person to buy in doing this passive intervention because you're invested in that type of treatment, or is it because they actually wanted it and you needed it?
Yeah, I think, and you mentioned there the word placebo, and you kind of talked about how choosing a placebo carefully is also important to allow for long-term improvement that doesn't lead to future nocebo. And you also said a term that I'd never heard before, and I think it was, I actually don't know how to say the word. It begins with an IATROG, genic effects.
Iatrogenic.
Yeah, so I'd love you to talk about where, as a physio, you might use one of these tools, or maybe even as a consumer, where I think some of these tools you can have at home. So like you said, the foam roller or the theragun, is there application for those for a consumer, and how does the physio go about like using them in the right way so you don't fall into the kind of noceboing yourself, or the isogenic, and what that maybe means as well would be interesting.
So iatrogenic is like relating to an illness that's caused by a medical like person treating you, either through the treatment or the examination. So a lot of big ones now we see are like people, like everyone that will go get an x-ray done, like it's going to show something on the x-ray. And then that act of having that exam done, or like a big one that most people consider is like, do you have a lot of chiropractors in the UK?
Yeah.
So like we have a lot of them over here, and they all start their own practice. And I have friends that are chiropractors that get upset by other chiropractors because they'll do like an x-ray on somebody or like an examination, and they'll go, oh, you see this and that and this, you have all these things wrong, so you need to buy this package for me to adjust you this many times per week for this many weeks, or things like that, when it's maybe not true and founded in actual like evidence and science. They're just kind of making something up to get you to buy into this package. So even if you don't stop showing up, they're still, making out in the long term from you, pre-purchasing this package. And the CBIC it's the opposite of placebo, where you take something that's supposed to be inert, and assign. So a lot of times we see it's like you assign specific meaning to it, and then that's where it causes a negative effect. Okay. Some of these things can be helpful for the general population because, there is some evidence that like massage and foam rolling, like in a specific window after a workout, can be helpful for decreasing delayed onset muscle soreness and things like that. But in general, it may not, it's not going to speed up the time that it takes your muscle to recover, or even your nervous system. It may help you subjectively, which is another thing that subjectively we can see, though, that like perception of RPE and things like that, it does play some role into, and there's some actual science that ties it into that long-term, like my sessional RPEs and stuff like that, changes, and that can be a predictor of recovery. So there is maybe a small way to like link it to objective recovery. At least in some of the science that I've said, and other people have talked about, like Eric Helms, I know, has done some talk of and covered some of the science, and as well as Austin Barake from Barbell Medicine. He's talked about sessional RPE and how it relates to overall like chronic fatigue. And I'm pretty sure the sports physio in Australia, Tim Gabbett, has also talked about it, but more relating to like soccer or right, football and everywhere else except for America, and other sports like that.
So is that where you could use a foam roller or say the theragun, and it could reduce your perception of fatigue as like a trainee?
Yeah, my thought is that like nowadays foam rollers are better. Like there's a lower barrier to entry, and you're not investing like $600. And like I think the name brand massage gun, like the first one, is like around $600.
Wow.
And there's even, you can go buy a kit now for your like jigsaw and put it on that.
Amazing.
And it'll cost you, like, you have this tool already, and it'll cost you maybe, I think it's like $30 to buy the kit.
So as a physique competitor, would the application be, I guess you probably would say, foam roller over, say, a theragun or something, because of the price difference? And I don't know if the theragun's giving us anything a foam roller doesn't. And then using that as like a post-workout treatment to heighten your subjective recovery, but it's not actually having any physiological improvements to our actual recovery. Is that right?
Yeah. The only stuff that I've seen is it may help with a delayed onset muscle soreness. It's gonna, if I just did a huge leg workout, all my, quad muscle isn't gonna recover and turn over protein faster because I massaged it.
And is that, I often hear, because I know like cold treatments and like heat treatments, they can help heighten recovery between kind of an overloading session, but at the cost of maybe adaptations. Is that the same with like foam rolling or the theragun? Would that kind of reduce any adaptations because you're kind of reducing like a stressor that we maybe want to heal itself?
Not that I'm aware of, because a lot of the soreness from delayed onset muscle soreness is like through a number of different mechanisms that's still like kind of being more widely understood, where it's like a combination of, like, people used to think it was lactic acid, but we know that's not true anymore. So there's like different components with how the nervous system's behaving and things like that are leading to these changes. And one of the big things is where people like crush themselves with a workout. I would say, like, if they're doing that, well, obviously, like, my first thing would be to do is probably, if we can change that and make it so your workouts later in the week are not affected by this one workout. Obviously, that would be the best way to handle it. But then if we can't get somebody to do that, at least maybe we can get them to foam roll to try and mitigate that.
Right. Yeah, that makes a lot of sense, I guess. Like, and I know Quinn Hennock, when I did a few sessions with him, kind of Skype calls, and a big factor that he talks about is just manipulating your volume. You're probably doing too much in a particular area that's causing the problem. I'd be interested to hear, obviously, you may use some of these tools now and then, but what, as a physio, when you practice on people, what are you doing? Kind of, I know you talked about how just actually listening to the individual can often go a long way.
Yeah, I mean, so a lot of times when I'm in like my like brick and mortar clinic, it's a lot of conversational, like getting into like, okay, what are your issues? What are your goals? What have you been told in the past? What other practitioners have you seen? And a lot of the people that I see, the majority of them are like, they've been to practitioners who maybe, because they can't find anything that they can cut out or medicate away, they just kind of end up brushing these people off. And really, they just need you to listen to them to be able to say, like, they've been heard, they've gotten their concerns, their complaints, their goals, like, out to somebody. And you don't just have your face in the computer the whole time, because that's a lot of times what ends up happening with the increase in there's a push for everyone to see more patients in less time, and to, have these bigger turnover rates because of, the way that insurances work over here. And it's like a big other mess that's a complex issue. But so these people get brushed off, and there's a lot of practitioners that may not understand, just because they don't have the training that we have as physios, and maybe don't explore some of these other avenues. Because, like, a GP is not going to be always studying about, like, oh, I need to learn this very in-depth, complex specifics to pain or to a specific, muscle injury or things like that. They're kind of worried about, my patient with diabetes or high blood pressure, all these other health habits that are going to maybe kill them in much quicker period of time. So sometimes, I don't know if I can't speak for them, but if they're kind of afraid to spend that more time, or because they don't understand that issue enough to give these patients the time they actually need to kind of help them start their recovery process. But they really miss out on that. And then, I mean, my biggest approach, I use this assessment method. It's called mechanical diagnosis and therapies. Most people know it as McKenzie, where it's based off of, different repeated movements. So if I can find a repeated movement that starts to develop better control for them, like they can use this movement as kind of like an alleviator for a symptom that they're overly concerned with, okay, that's a good strategy. And then from there, it's a lot of like, let's, work on strength principles, let's work on endurance, like different things like that. And it all depends on what somebody's coming in for. We just happen to have a very high percentage of our patients that come in for persistent pain issues, like lower back issues or neck. Another big population we serve specifically at my clinic is people that have migraines, headaches. So there's probably almost like half of our patients, I would say, are migraine and headache patients.
Oh, wow. Yeah, I think it's when you were talking that through and then you brought up GPs, it's very similar here in the UK. I've been to see my GP, and quite often you don't feel listened to and you do feel rushed. And there's something just very therapeutic about having someone who seems like they really care and are listening to you. You may get the same result and the same outcome, but one will feel like it just de-stresses you a hell of a lot versus the other. And I guess like it's a very complicated topic like pain and things, but headaches, I imagine a lot of that is psychological, and just by actually listening to someone, caring, that can have a big, profound impact. Have you found that to be the case for yourself?
Hey, Pascal here. I just wanted to take the moment to talk about our membership site. Inside, you'll find a thriving forum, an extensive exercise library, courses, presentations, and research reviews. All I need you to do is hit the link in the description below and sign up. See you there.
Yeah, I mean, to a degree, because it's just the fact that you have this concern about this issue, and it gets a little bit into philosophy. If you've come to see a practitioner, well, now I've assumed this role of illness, and I'm seeking help for it. Even if somebody cannot provide me with something that may like immediately affect my symptoms, I still want to be, I want my complaint listened to. I want to know kind of what's going on with the issue. What can this person actually do for me potentially, even if it's something that's not going to help immediately? Like, what would be our game plan to see and make sure, like, specifically for me, like what am I going to do maybe to help this person if we find that things don't help? What's our next step? And then like some people want to know like how long it's going to take, what's their right. cost investment, things like that. But once and then provided a lot of times reassurance, like somebody comes in with shoulder pain and they've been told they have shoulder impingement. I don't know if that's a term you've heard of before, but most people know it. Everybody's always concerned, oh, did I hurt my rotator cuff? Like things like that. Well, it's like, you can get into some of the complexities of that, but you don't always have to. And it's like, no, like your rotator cuff is fine. Like you haven't torn it. You're not going to need surgery, things like that. And then just by reassuring them, they're like, oh, I feel so much better now because I know that that's not the problem.
It reminds me of I've had clients who are struggling dieting, and then you say, okay, we'll give you a refeed day, or we'll take a diet break right now. And then they report back saying, as soon as you told me that, I was no longer hungry. It's kind of like you just calm them down. You just give them a solution. They're like, oh, actually, there is maybe nothing as severely wrong as we first thought. And something you've spoken about as well over on your social media was like posture. And you talked about kind of listening to people, what they've heard. And I think there's a lot of maybe cultural beliefs around posture and what good posture is and the kind of harm it's causing us. I love to hear kind of what you see is the misconception around posture and what the reality is in terms of what pain it's potentially causing or not causing.
Yeah, I mean, I think that gets into the culture of beliefs that like there's always this nowadays too, like there's this, my friends will send me like memes they find on like Facebook and Instagram because there's like this cultural ingrained thing of like, oh, when I get older, like I'm supposed to hurt, oh, my toaster went off and I turned my head quick and that's why my neck hurts, or like different things like that. So I've been doing kind of like trying to come up with like posts for that. And everybody that comes in, they're like, oh yeah, I know I have like crappy posture. I know I have this or that or the other thing that's crappy. And I'm like, but like, where did this belief come from? Like, why do you think that? And like, kind of unpacking, because we're finding that long term now, when we look at like things like, there's been some big reviews recently. Like the most recent one was like 2017 or 18 on lower back pain. It was done by a journal in the UK called The Lancet. It's one of the oldest journals in existence, actually. They did a worldwide kind of like effort to look at into back pain and like what's so costly about it, what are things that can help, what are our like kind of standard approaches should be. And they're finding that in science, like when they actually study about posture, there's not a really great link to certain postures to causing you to develop symptoms, and even like ergonomic programs in of themselves, like having different changes in your posture, preventing the onset of symptoms. So we know it's like, it's not this one-to-one correlation where if you have this certain posture that it means you're going to develop pain, because bodies are adaptable. Like one of my friends just did a interview with Greg Lehman, and he had some very good things to say about it, where it was like, he's like, I believe that biomechanics always matter, which I also agree with, but he goes, I believe that they matter for different reasons. So it's because a lot of times performance in, like, if we're thinking of hypertrophy, like I want to put a stress on a specific area because my goal is to maybe like make this muscle bigger or to develop strength in this particular position. But if you're consistently in a position, you also have to think of like, there's, you know, the SAID principle and Wolff's law and things like that. Well, why all of a sudden do those principles not hold true just because I'm in a different position? Like theoretically, like that doesn't make sense physiologically. Like those tissues should still be adapting because I'm applying a specific stress over a certain period of time. And there's some link to some of these changes that we may see because of, you know, changes in blood flow or whatever, but to our nervous system and to our body, that doesn't always matter. Like that's background noise. And it goes, I can kind of ignore that. That doesn't matter right now. We don't need to worry about that because I'm able to adapt and overcome this stress. Versus there may be other times where you become sensitive to these positions and things like that. Well, now us changing the positions you're in or things like that, that matters quite a lot more because we're trying to desensitize this. And if I keep pushing too much into this, sometimes that only allows things to hang around longer. Because just like strength, like I think it's Mike Teixeira that always says it's either him or what's his name, Gary. They're saying strength is a skill. You know, I forget who says it, but it's the same thing with pain. Like your body, that's just another skill, a neurological adaptation. The more you're in pain and not necessarily allow, but have these symptoms, sometimes it's easier for your body to produce it because it goes, hey, this is a familiar pathway. I know this. So it's going to be like, oh, that's easy to turn that on now.
I guess so. Do you think potentially people undervalue how adaptable the body is, and we almost think it's more fragile than it necessarily is, and in fact don't give it enough credit? Is that kind of what you're saying in that regard?
Yeah. Is that like we generally have these perceptions that are continuously like perpetuated through our societal and cultural beliefs and kind of things we learn from being children that like, oh, like, yeah, the body is meant to be protected and it's frail. But I mean, when you look at the history of humanity, like if you look at all the things we've been able to do, like that would kind of already it's in and of itself say the complete opposite.
True. And actually one of these things that we hear quite a lot, and I have certainly said myself, is kind of neutral spine. And you recently did a post on that as well, in terms of like how a lot of PTs are cueing it, and then actually it's been kind of, even though we're perceiving it and viewing it and it seems neutral, that actually there is some flexion going on. And obviously the kind of I guess the cultural belief is flexion of the lower back in particular is incredibly dangerous and should be avoided at all costs. So I'd love, again, if you could talk around that point.
Yeah, because it's an interesting concept because that was something that like I previously had bias on and things like that about, like, you know, oh, the flexion is bad, and like if you do that you're gonna hurt like your discs and things like that, which there's some evidence out there that says it can cause disc changes, but a lot of the studies aren't done in like live humans. They might be done in models or cadavers and things like that. So that's harder to extrapolate that evidence towards like a living person that still has adaptability going on. But this was in particular based off a thesis that was mentioned in an interview, and then I asked for the paper and looked it up. I think the physio, his name is Scotty Butcher. He's known as a Strength Jedi on Instagram. Right. It was one of his students who did their thesis in kinesiology, and they took these markers of different positions of the spine during high bar, low bar, squats, a deadlift. I think they did a sumo. I know they did like a hips high and a hips low deadlift, and then they measured the amounts of flexion and like shearing forces at the joints of the spine. And what they found was that there was like, regardless of if to a trainer, like somebody who's trained, and in their case it was like a strength coach and people in kinesiology, that when you appeared that we were in a neutral position, your spine would still flex at the bottom positions of a squat and at a deadlift to a large enough degree. It was like 70% of maximal flexion of the spine. And it was previously thought that any amount over 30 to 35 degrees was like the like terminal flexion that would cause some type of disc injury. The maximal flexion is like, it depends on which source you look at, somewhere between 60 and like I think 80 degrees. I should know because I have a test tomorrow for orthopedic certification. But they used to think that was going to cause injury, and then the shearing forces were quite large too, larger than maybe before had been perceived to cause an injury. And it's like, okay, well, if that's occurring on a regular basis in this population, why doesn't every single person that squats or deadlifts have all these issues? So it's
absolutely.
like this continuation of like, okay, maybe flexion matters at times when people have specific things going on for them, but it doesn't matter in the ways we used to think that it did for everybody.
Yeah, and I guess in terms of being a personal trainer, and I guess if you're coaching someone, I'm not sure if you coach people, but if you were coaching someone, do we still coach them neutral spine? And how do we coach that positioning of the back now? What is deemed as kind of safe, and like what are you deeming as, I guess, when we visually see flexion, is that when we're at the point where we're really like that's far, like that is too far now, or do we not actually know?
Well, I think that in general, you're going to think of as the idea is you always have to have something to go off of, because you're going to need a framework, because some framework is better than none. Like you can't just, like the example I used for somebody, I was like, you can't just all of a sudden like take somebody from, I don't know, say like, just think of somewhere where they maybe don't even know where like basketball is or like football or something. And all of a sudden you put them on a pitch or a court and you're like, okay, here's some balls and those are goals and go ahead and play the sport. Like it's not going to work out well. So you have to give some kind of idea, and like your trainees, your patients, your things like that, they kind of want that framework too, at least a little bit. Because they're maybe unsure. Like you may have somebody that's not really done a lot of these movements before. So you have to instill some confidence there, but also there's going to be a point at which like just the way the physics work is going to be better for that person. So it's a matter of like finding that position. I think we're less worried about that causing them injury, more of like, this is going to help the performance, and again, put the stress where I'm intending for the stress to go to cause this specific adaptation, more than I'm worried about, okay, you're going to get hurt if you're not in that position. Because we can still see like, variability in your training form. Like you may never have a perfect technique. I mean, that in of itself could be helpful to prevent injury, because I know even like if we look at like Olympic lifters, some of them purposely train knee valgus, because that's often a position they are going to get into when they're doing maximal lifting. They need to be able to get out of that position to save. They're maybe not even worried about getting hurt there. They're worried about saving the lift so that they can complete the lift to meet standards.
I guess as a lot of the people listening to this, some of them will be powerlifters probably. So I guess actually what you're talking about there in terms of getting into positions that maybe they want to be strong in so they don't cause injury when they are lifting maximally is a good preventative. I guess for maybe someone training for hypertrophy, like you talked about, technique is important to keep tension on the muscles where we want it to be. So I guess for them, maybe they always want to try and work with as good as perfect a technique as possible, so we are training the musculature, because we're not looking for that maximal performance, and we shouldn't necessarily be getting into these kind of positions. Is that something that you think would be applicable to the audience?
Yeah, I mean, like, yeah, that's what you're thinking about, is like, what is going to help me the best on meet day? What are the things that I don't want to develop this habit of always getting to this specific position, because it's going to make it harder to complete the lift. And then if you're trying to focus on hypertrophy, okay, well, what muscle are you intending to grow? Or like, because I mean, I'm sure I go in the gym and sometimes I do stuff and I'm like, somebody's going to think this looks really weird, but I specifically know like that I'm trying to target this very specific spot.
Right.
Because that's where I want it to grow. So it's like, well, this is the best angle of pull to be able to grow that specific area. So yeah, those are things that we're focusing on, more of that than we are like, oh, if I don't do that, then I'm going to hurt myself every time.
Yeah. And actually, in terms of, because we talked about the back, but another one, I guess, and I don't know, I think there might be some evolving talk around this in terms of, I'm seeing some people who are kind of expert in biomechanics talking about scapular position on maybe rowing and also on like bench pressing. And I think a lot of the advice maybe has come from, like, generally the advice is to retract and depress maybe on like a bench press. And now it's coming out that maybe people are discussing having freedom in the scapula in pressing movements, and then similarly in pulling movements. Kind of what's your, from a kind of physio perspective, what you cueing, what do you think's the kind of best practice for those sort of movements?
I mean, that's for like a bench, that's usually what I cue, just because of the effect on, there's some thought that off of a stable base that it's a little bit easier to press off of. I think that's a little bit true. I don't know as much, I haven't studied that specifically recently. I don't think it would lead to like any problems with injury or anything, but I just know that generally if you're stable at the base, it's much easier to press from. So I mean, I tell people to keep back, but I guess you don't have to be like, you don't have to pull maximally back like while you're bench pressing, like as if you were going to do like a row, like you were doing a row at the exact same time.
Is that a case? Is it safe for the shoulders? I think it's part of a kind of also stability, but also safety was kind of often the thought of retracting during a press. Is it as the bar's coming down, kind of, are we in a safer position by retracting, do you think, or?
I don't know. I don't think it really makes as much of a difference. I think they're probably thinking about like that impingement area and like not reducing space. There's a specific area underneath your collarbone, like here in the front of your shoulder, where there's one of our rotator cuff muscles, and it has a finite amount of space. But the problem is that when you normally move your arm, even start to lift it like to the side, just like barely, like if you were going to reach for like at a coffee table or anything, like you're already starting to compress that muscle there. So it undergoes normal compression throughout our daily life and movements. And I don't see where there would be maybe what they're thinking about too, now that you're mentioning it, doing my current studying for this exam that I have tomorrow, is that there's this phenomena they've observed in cadavers called a wringing out effect, where it kind of like this, that they described it as like wringing out a towel of one of the muscles when you're in a specific position. But again, you have to look at that was done in cadaver studies, and that may not be applicable to living humans.
Yeah, fantastic. And then similarly in pulling movements, what are your kind of, are you allowing the scapula to move there, or are you kind of retracting it, do you think, before kind of producing like retracting it back or depressing it rather before doing a pull up? Or do you have are you thinking about it to that level when you're exercising during pulling movements?
I mean, the way that I think of it is because I've looked at a different number of people and worked with a few different people, because before I worked with 3DM or with strength guys, I was actually a client of Alberto Nunez. So we had discussions about things like that. And I've always listened to some of their things. And I mean, and Mike Israetel, and we can think about too, is like, if you're trying to use those movements for hypertrophy, and we think about the muscle, like insertions and things like that, there's going to be some of them in our back that we're going to try and be growing through a rowing or a pulling movement, that if you don't allow the scapula to kind of move away, like into protraction away from your, being pressed together, or allowing them to rotate up, you may not be achieving the maximal amount of like range of motion, and then you're kind of shortchanging a little bit of volume during those specific movements. You're going to be ultimately stronger if you're kind of in a flatter back position, and you're not like using your hips to compensate, but you can get a little bit free as long as it's not like you're like jerking around like you're trying to start a lawnmower or something like that.
Absolutely. I guess the same would apply to retracting. You're kind of shortening the muscle to its fullest extent, so you're getting that extra range of motion.
Yeah, exactly.
And then I don't know if this is something that you're familiar with as well, Jacob, is active range of motion for muscles versus like a passive range of motion. So you think about like some people you mentioned Mike Israetel, he comes very deep on his leg press, and probably part of that is because the load is pushing him into passive range of motion. Whereas if he came to his active range, it might be, I don't know, a number of inches less deep than that. What's your, from a physio perspective and like safety perspective, and maybe even a hypertrophy perspective, what's your kind of thinking behind active and passive range of motion? Is that something you differentiate between or think about when you're training?
I don't think about it more when I'm training, more of like I look at like if I'm measuring specific joint angles with a patient. I think some of the differences we can see when we're training could be definitely like nervous system adaptation, because like the way that I describe it may not even be the best way to describe it, but is like, think of a suspension in your car, like a battered suspension in a car, like maybe hard, depending on what you're carrying or things like that, maybe like a stiffer spring. Like if I have a truck and I want to carry a maximal amount of weight in the back of it, I want a very stiff spring because it's going to allow for some compression and give, and it's going to take that amount of weight to compress that. So it's the same thing, maybe similar, when like I can't achieve like squat depth or like a great deadlift position if I don't have some kind of weight on my back or on the floor to be pulling from.
Yeah.
And I think part of that is you're going to see an adaptation in your nervous system. Is going to say, hey, like I'm normally used to lifting these kind of loads, so I need to increase the tone here, so that needs to be stiffer, like spring, so to speak, to generate more force. So we'll see like weightlifters, anyone that lifts may have like what are perceived to be tighter hamstrings. And it may not be that the length is shortened. It may be that because you're specifically asking that muscle to always exhibit a strength characteristic, like it's naturally developed more of a tone, and you can get it to relax. Like I can't touch my toes if I just try and reach down. But if I were to work at it, I can gradually get down there. So there may be something like that we're seeing more so you can get into these positions when you're under loads more than when you're just like at a lighter weight or things like that.
Hi guys, Steve here. Just wanted to take a moment of your time to remind you of our online coaching service. At Revive Stronger, we pride ourselves on providing personalized service that will take your physique and knowledge to the next level. If you're interested, check the description and sign up.
Yeah, I guess from what I've seen, and I don't know enough about the subject to talk about it deeply, but active is kind of the range that you have control over and that the muscles will allow you to get into. And I guess if you were to limit yourself to active, you might eventually, like you said, be able to improve that range as you kind of use it more and more, and you might get deeper and deeper. Do you think that's something you should limit yourself to, and that should be your full range? Like when you think about full range of motion, is that full range, or is getting into some passive range full range for you?
I consider like getting into some passive range, still like full range, because it can be deceiving as to what your active is.
Right.
Especially once you start like lifting, you may be getting into a period where, oh, now I have more motion and I can control that. I mean, because as long as you can press out of that position and things like that, and you're not like safety wise getting like pinned by a weight or something like that in a position that's unsafe and you can't control it because of like, you know, a bench press falling on you or like a squat pushing you into the floor or things like that. It's perfectly fine, because I mean, I see that with my patients too, is like they maybe come in and we're in like a phase of their recovery where they're like, I'm returning them to full activity, and they may not be able to achieve certain motions until they've like done a few things, and then, oh, okay, now this motion's better. And that's not necessarily a sign, you know. And there's some to hypertrophy for this. I remember a while back when it was like the Barbell One podcast was still going every day. He was discussing the difference between hypertrophy with specific movements like RDLs and like glute ham raises and things like that. And there's some to that, like having to learn to control through these passive motions and getting in these positions of stretch that we may not normally get into appears to have some benefits on hypertrophy of a muscle too.
That stretch under load type of dynamic. Yeah, I've seen similar things. So no, that's really interesting. I guess if I was to summarize it, you suggest maybe for a trainee, full range of motion for them would be the range that they can control safely with the musculature that they're trying to use, and that could lead into passive range still.
Yeah.
Cool. Awesome. So something I wanted to pick you up on actually was one of your memes was really, it was funny. It was one of those, I can't remember what it was. It was like the guy drinking coffee and he had his billboard in front of him and like, try and disagree with me. Tell me I'm wrong. And it was to do with ab training not impacting the way your abs will look, and talking about how doing more there is potentially unnecessary volume. So I'd love for you to, again, what are your perceptions on ab training? Can it cause thicker abs, or do you feel like it's something that's just, again, essentially unnecessary?
I think it could if you're specifically like training for that physique development. I had an interesting discussion actually with one of my like friends after I posted that, and I'm like, man, you're going back, like you have a good memory, because it's one of those things where like I've discussed it with like Alberto, and like they've talked about it with like 3DMJ and things like that, and it's like, is it something you need to always specifically train? Maybe not. Like you can still obviously make the muscle bigger, but always, is that something you want to be achieving? Because in physique, we're thinking about like that taper look, you know, the V taper. So, I mean, if you're theoretically, because it's such a subjective sport at times, like, would you want to change the insertion of your oblique or your abdominal to make even this perception that your hips could be potentially wider, that could like not ruin on somebody, because you'd have to hypertrophy this muscle a lot to ruin a taper. But, you know, maybe there is somebody, like there's some people that could potentially see enough of a difference in the sharpness of the muscle there, that maybe get like a fuller look and things like that too. Because if you're exercising that muscle, obviously it's going to pull more glycogen and things like that into it, get a pump there, and then it's going to look better like for a stage presence. So for physique, I think you could argue like either way. I know most people don't focus on it, because to actually like obviously create like a six pack and a V taper, there's a matter of losing body fat, and there's something to the fact that even when we do specific movements, there's a lot of other movements that may actually cause a larger activation of our abdominals than actually doing like traditional like abdominal exercises can achieve. So like there's some studies that had shown that like doing a push-up caused more activation of the rectus abdominis than while you're doing like a crunch or a curl up. There's some that show like a deadlift, a squat, and kettlebell swings may activate like your obliques and some of the smaller muscles in your lower back as well to a large degree. But I think if it's a matter of weighing out, like, does this have a place in their total volume and what they're able to recover from, and the client's like desire and need to like train that. Because if you're doing like things for health and you can get them to enjoy a workout more by like, okay, I'll throw in a couple ab exercises because I know you're going to like that. That can go a long way too to compliance and adherence to their training program for long-term benefit.
Yeah, it's certainly, I think, if we were to take that meme at face value, it would sound like you were completely saying never train your abs. But having talked through with you, it's very much a case of like case specific. And I would agree, a lot of people are better off spending their time on other things and recovering from other things than necessarily worrying too much about their abs, because it's something I've taken a lot of time to focus on in the last few years, because I do not have good abdominal development. And if they have grown, when I think they maybe have, it's very much to a small extent, and I can I can prioritize my time to allow me to do that. Whereas if I was giving this to everyone, they would hate me probably, because it's ab training. Like you said, you may add it because it might make people feel better. I end up removing it because people hate training their abs, and I'm certainly one of those people as well. So yeah, really good discussion on that.
Yeah, and unless you're like, unless you're an enhanced lifter, you're not gonna have to worry about like your gut really getting too big. And that's for different reasons, anyways.
Absolutely. So yeah, actually, to finish up, Jacob, I think this has been a fantastic chat, and you've really kind of brought out some points that are very, very interesting. And I think for a lot of the listeners will have allowed them to feel more confident and comfortable within the gym and what they're doing in terms of various things, and hopefully getting the best out of their physio or their GP as well.
Yeah.
In regards to like physique training in particular, are there any common myths or misconceptions that you see out there that a lot of people end up believing or doing that frustrate you, or you'd like to just like squash, that we haven't spoken about, I guess?
A lot of them are just common ones that we see all over the place, like this misunderstanding of like what you need to do to achieve like specific like physique and fat loss goals and things like that. Like the whole with the kind of revolution of like if it fits your macros and all these other things that I think that have been good trends in fitness, we're starting to see some of these things improve. But like still a lot of people have these outdated beliefs of like, oh, I got to do cardio all the time and I have to eat this very like bland specific diet, or now the big one is like keto and stuff like that. So I think it's like just in general, like the thing is like the people that need to hear that you need to go out and resistance train are probably not listening to your podcast to begin with.
Very true.
Because that's the big thing that I see, is that like people want to achieve these specific goals, but then aren't necessarily doing productive things towards like things that are going to increase your base metabolic rate and achieve like that quote unquote all the time I always hear about like, oh, I want to look tone, or I want to get toned, so I don't want to lift heavy weights or like lift weights. So it's like kind of those like common ones that we all hear once you become a gym goer that you just kind of roll your eyes at. Yeah.
I guess actually I don't know if these are good examples, but I'm going to try two for you that I hear that are kind of more so physio, maybe specific in terms of maybe inactive glutes and then like tight hamstrings. These are ones I hear a lot, and I don't know if they're myths or misconceptions, particularly tight hamstrings. Like hear that all the time.
Yeah, I think those are like misconceptions. Like the whole idea of like glute amnesia. I think at a couple studies they may have found that like that people just appeared to have less activation when they were in pain of their glute muscles. So then all of a sudden it became this whole thing of like, oh, so we got to have everybody do bridges and clamshells and abductions and different things like that. And I think it's more of they were in pain, so obviously it was harder to contract a lot of musculature around their back. And because especially the glute max has its origin at the upper portion of our hip muscle, or our hip bone. So that's actually right where the tie-in to the lumbar fascia is, where the lat starts it starts its origin. So you always got to think is that when we go over anatomy, it's always either the area that's the highest on the body or is closest to the midline is what would be its origin, and then the insertion is the furthest away, either away from the body midline or to the lowest portion. So those tie in together, so it makes sense that like you would have that. And then for hamstring length, it's either, it gets back to that neurological adaptation. Is it, well, your hamstring is actually tight, or is it developed this adaptation because I've specifically asked it to, I've asked it to deadlift twice my body weight on a regular basis? Or if somebody's having back pain, you can also notice that, okay, well, with your hamstring muscles, they attach to your pelvis, which affects your lower back position, as well as the nerve that comes out of your back and goes down your leg runs with your hamstring. And in most people, it's actually about the size of your index finger. And our nerves become very sensitized when we're in pain, because it's like the quote that I like, that I heard, that I often say to people is like, nerves are really easy to piss off, and it's hard to get them to quiet down again once they're pissed off. So you may not damage the nerve, but when you're trying to stretch your hamstring, you're also lengthening that nerve. And if it's already pissed off because your back is sore, then that's going to be perceived as the tightness, as well as if you're having any soreness or anything there. This is if somebody's in pain specifically. Those muscles are going to try and help to guard the position that your lumbar spine is in and prevent you from rotating your hips too far forwardly or backward. So it's going to splint you, kind of like if I had a rock in my shoe, I'm going to limp.
Right. So it's kind of, definitely misconceptions in that people perceive the issue to be something that it necessarily isn't. It's kind of like the body has all these links and chains, and you're kind of, this is why I guess someone like yourself has a job, so you can get people to correct it in the right way. So Jacob, I want to say a massive thank you again for coming on, having this chat with me. I think it's, like I said, been really interesting. I want to make sure if people want to, seek help from you, or obviously check out your Instagram, where should people head?
So I have an Instagram, obviously Strength and Evidence Physio. That's where I'm going to be the most active more often. I have a LinkedIn for people that want to like maybe connect otherwise. Like I'm Jacob H. Templar on there, because I generally have been trying not to have people on my Facebook, because I kind of end up keeping that as like a private, because I'll go over like politics and post stuff about my daughter and stuff that I don't necessarily want everybody to see. Trying to think. I just have, those are my main ones right now. And then I just started doing a research review that I'm launching at the end of this month, actually. I've been talking about it on my Instagram. So if you're interested at all into that, you can check that out there too.
Awesome. Thank you so much, Jacob. And we'll catch everyone soon. Take care.
Thanks for having me.
So I'm Steve Hall, founder of Revive Stronger and a coach of Revive Stronger.
My name is Pascal. I'm the co-owner of Revive Stronger and also a coach, of course.
Revive Stronger has probably been going solidly for 3 years, roughly about 3 years.
Revive Stronger, to me, it is becoming kind of my child, my foster child. It's the gathering and getting together of like-minded people.
We've been expanding the coaching team, which is helping us help more people, but each coach can only help a certain number of people.
Right now, it's all over the place. We have YouTube, we have Facebook, we have Instagram, but there isn't that community aspect behind that.
And so the next step for us is developing a membership site.
So basically, we want to create a family and a community that is then benefiting from another.
A really cool community for people within our little niche is going to be a website.
They will get early access to our podcast.
You can access us, ask us questions.
The community aspect, we have a forum there. You can ask questions, but also you can log your journey.
There's also going to be courses on there.
Courses, presentations on different topics. Discount of past seminar footage. We will log our journey as well. We'll start vlogging.
We're going to have documentaries.
Our entire athletic journey. Furthermore, they get access to an exercise video library.
The exercises that we love for hypertrophy and maximizing hypertrophy, we're going to go through those in depth, telling you how to execute them.
We kept them concise and also mobile friendly so that you can watch them in between your sets.
I'm super excited to grow this community. The amount of value that we're going to be delivering is huge, and I'd love you to be part of it.
You will get so much out of that.
I'll see you inside.